Nuffield Trust Summit has become a permanent fixture in the health policy calendar. And in March 2014, around 150 health leaders gathered for the two-day conference in Dorking, Surrey. Nigel Edwards, incoming Chief Executive of the Nuffield Trust, introduced the 6th Summit, which concentrated on the key challenges facing the healthcare system, including quality of care and who is driving change in the NHS in England. The summit was held as we approached the first anniversary of the coalition government's NHS reforms. We heard the views of the Secretary of State for Health and the Shadow Secretary of State for Health about the state of the healthcare system ahead of the 2015 general election.
I believe an NHS that is based on the notion of people before profits is actually an ideal worth fighting for. That is what people trust. But I'm not so sentimental to think that that system won't survive if it doesn't fundamentally change how it thinks and works. If we're to protect that ideal, that is essential, or it will not be able to meet modern standards.
There are very, very serious challenges, real challenges to implement the Francis agenda, real challenges to tackle the challenges of an ageing population. But I think what you've got is a set of foundations that we can build on. And I think with the commitment of people in this room and many, many other people, we really have got a chance of making the NHS once again the envy of the world.
This year we explored the quality of care that patients are receiving, following the major reports from Robert Francis QC, Don Berwick and Sir Bruce Keogh, and considered which approaches work to improve quality and which do not. Our international keynote speaker looked at whether accountable care was an option for a faster route to better quality.
What is an ACO, Accountable Care Organization? As you can see, they're growing very rapidly in the United States. What we're doing is taking shared financial risk on a defined population. The defined population are patients who are aligned, and the word aligned has been debated a lot, to primary care doctors.
A major research programme between the Nuffield Trust and the Health Foundation, Quality Watch, was featured at the Summit 2014.
The programme was devised really to monitor quality independently of the statutory organisations during a time of financial difficulty. And what we were particularly interested in was, as cuts are made where necessary, where economies are made, can we be assured about what's happening to the quality of care during those difficult times?
At the summit, health and policy leaders also debated how health services should be changed and delivered differently, exploring innovation in the UK and abroad.
Although it is true that healthcare, for fundamental reasons, is not the same as retail or financial services, there is a lot we can learn from the degree to which costs have been saved and the customer experience improved through the use of low-cost, ubiquitous mobile technologies.
We discussed how providers and commissioners can respond and deliver healthcare efficiently, particularly in a time of financial constraints.
As the health service gets better and better, it does less and less in the sense of the old-fashioned things which show up in the GDP numbers. So we need to be really careful about how we incentivise people to do the right sorts of things. And for me, it's all about trying to incentivise the right behaviours for the public.
The summit ended with a lively discussion on how to maintain support when making difficult decisions.
I've just finished chairing the People's Inquiry into Healthcare in London. We publish our report in a couple of weeks' time. And the really overwhelming thing that comes out of the evidence, and I don't want to preempt the report, but is the extent to which people's opinions are actually ignored, how badly consultation is handled. And I don't know why we even bother people with consultation, because we don't give a toss, we're going to do it anyway.
We are grateful to all the speakers and delegates who attended our summit and contributed to the lively discussions and debates. We'd like to thank our media partners, the BMJ and the Guardian's Healthcare Professionals Network, our Quality of Care Strand supporter, the Health Foundation, and our supporters Frontier Economics and Boston Consulting Group. Watch exclusive video interviews with some of our speakers and access their presentations from the event via our website.